Welcome back to Midday Kentucky, everyone. Well, if you're one of those people that live with constant pain and you just don't know what to do about it, well, I'm sitting here with Dr. Benjamin Sloop from Clark Regional Medical Centre, and he's going to help us understand what we can do to fix that without being overly assistant on drugs as well, right? Welcome to the show, my friend.
Thanks for having me, Troy. I appreciate it.
Talk to me a little bit about, it must be a very difficult profession for you to be in when you talk to people who are constantly in pain. Why did you decide this form of medicine?
Well, you're exactly right. It is difficult to talk about pain all day long. Well, a couple of different reasons. I was fascinated by the idea of pain as a disease during med school.
Yep.
It spoke to me because my grandmother had a lot of pain issues, and a pain doctor did amazing things for her. I have some pain issues myself, so it really struck home with me. And then I really enjoyed the procedures that they do, and I also enjoy a lot of the patient contact that they are able to do as part of their treatments and their practice.
Well, let's talk about those treatments and some of the pain issues that you deal with. And you're talking about taking people off opioids, pain medication.
Yeah, we would love
the pills.
The pills, yeah. Certainly, you know, there's a lot of trouble with the pills and the addiction in the area. It's nationwide. Our approach is to try other things to help people's pain. Namely, what we like to do is a procedure where we're placing medication on the source of the pain to try to get the patient pain relief.
Give me an example of an area that so everyone sitting at home can understand what you mean.
Sure, certainly. So we were just talking about how you've been at the gym, maybe you've injured your knee.
Yeah.
Maybe you're not appropriate for a knee surgery, and this has been ongoing and resistant to conservative type treatments. What we can do is we can do a needle-based procedure to put steroid medicine on the nerves around your knee that communicate with your brain and tell your brain that your knee hurts, and we can numb those nerves there and give you pain relief.
Now, this isn't acupuncture, is it?
No. This is far from acupuncture.
Okay, this is truly something that is more long-term?
Yes, these can be much more long-term. A lot of our patients see anywhere from a couple of months to a year or so of pain relief. And certainly we have other procedures as well that are
Let's talk about that.
Some implants that we do, spinal cord stimulators, intrathecal opioid pumps are some of the more long-term, long-lasting things that we do to help people have pain relief.
Do you suggest if someone comes into you and they are suffering from pain and you've diagnosed where that pain is, what has caused that pain, do you try to stick to the injections first before going down the road of operating?
You know, it really depends on the problem.
Yeah.
I'm not the one doing the operating a lot of the times, but yes, I think injections can be a very necessary and helpful bridge to someone who may otherwise be facing surgery. A lot of times we can postpone surgery for quite a long time with injections, or we can help the patient get pain relief so they can become a better surgical candidate if they have other comorbidities.
That's the answer I was looking for. I was also telling you off camera that a girlfriend of mine in Australia was a mad skier, and she had several injuries and ended up having 2 knee replacements, but they wouldn't do the knee replacements to begin with because she was too young.
Certainly.
So she was having injections. Is this what you see, people coming in who are too young for operations and go down that road of injections?
Certainly, I see it every single day.
Okay.
Every single day. And you know, there are a lot of people who, for whatever reason, can't take opioid medicines. Maybe they have side effects to them. Maybe they're not a good candidate for them. Maybe they don't want them. Maybe they are interested in a knee replacement or some sort of surgery, but like I said, maybe they have heart troubles or other reasons they can't have those surgeries. So this is a way to get them pain relief without medications.
Doctor, I want to ask you one question, something you said to me off camera which I found really interesting. Pain is a disease. Explain it to our viewers and what you mean by that.
Definitely, and I think I mentioned that earlier as well, that's one of the things that really struck a chord with me. Pain is almost like a disorder of your nervous system.
Yeah.
A lot of people are probably familiar with people who have heart problems like atrial fibrillation, where your heart beats irregularly. That's a disease of the nervous system in your heart. Well, certainly your bones and joints and other areas of your body can have disorders in their nervous systems too, and I think that manifests itself a lot as chronic pain.
Well, I think it's fantastic. I want to have you come back and show what this procedures look like.
Certainly, I would love to come back.
Because they're long needles, some of them, aren't they?
Oh no, they're teeny tiny, teeny tiny. Lots of numbing medicine.
That's what we like to hear. If you want to find out more information, about Dr. Benjamin, there's all the information up on the screen. Clark Regional Medical Centre, you can find him over there. There's the phone number and the website. We appreciate you coming in.
Good to be
After
here.
the
Thank
break,
you.
everyone will learn more about venous disease from Dr. Barsha of the Lexington Vein and Aesthetic Centre. Stick with us, everyone. Susan, I hope that helped you, that information.